fighting the ravages of the common cold virus.
From sunny South Florida, it's Open Line Friday.
It is the fastest 3 hours in media. I am your host, Rush Limbaugh, the most talked about radio talk show in America, the most commented on host of the most talked about radio program in America, program that meets and surpasses all audience expectations on a daily basis. That is no mean feat either. Just great to be with you. The phone number as we head into the weekend is 800-282-2882. The email address, lrushbaugh@eibnet.com. Public support for President Obama's health care law is languishing at its lowest level since passage 4 years ago. According to an Associated Press GFK survey, 26% of Americans support the Affordable Care Act. Even fewer, 13%, think that it'll be completely repealed. A narrow majority expects the law to be further implemented with minor changes. Impressions of the health care rollout, while low, have improved slightly. They go on to say only 5% of Americans say the launch of the insurance exchanges has gone very or extremely well. The number who think it's gone at least somewhat well has improved from 12% to 26%. So they're doing everything they can at the AP to find good news here, but there isn't any good news to be found. 26%. And not to be repetitive, but folks, this disaster has not fully reached people yet. If you have been subjected to any kind of a waiver or a delay, whatever problems you've encountered up till now are going to be dwarfed by the reality that hits you when your waivers expire. You're going to find out that the insurance policy that you can afford does not have a hospital in its network, for example. You're just going to be amazed. You're going to end up realizing that all this is a transfer of wealth. You know what ObamaCare really is? It isn't about health care. And it really isn't about health insurance. It is about continuing to transfer wealth from producers to non-producers. It is about subsidizing people who are working and earning income, subsidizing people who don't, paying for them to have health care, paying for them to have health insurance. That's really what this is all about at the end of the day. And it's so blatant that when all of these waivers expire, people are going to see this. Now, these waivers will expire after the elections. A couple of stories to illustrate what I'm talking about. First, David Hogberg at the Federalists, celebrating another phony ObamaCare milestone. This week, the Department of Health and Human Services reported that enrollment in the ObamaCare exchanges had reached 6 million. On Wednesday, the regime said that the March 31st deadline would be extended into April for people who had trouble signing up to the website. But that was yesterday. From today's release, millions of Americans have gotten health coverage through the marketplace in the last 5 months, and there's still time for you to join them. But you need to act now. The deadline to enroll for coverage this year is Monday, March 31st. Now, wait. It was just yesterday and the day before that they moved that. Now they're back to March 31st. And what's going to happen is once March 31st rolls around 3 days from now, that will be Monday, the regime will probably say that there's still time to sign up. And what's happening here is that the administration is making this stuff up as they go. They literally are making it up as they go. There is no working program here. There is no functioning piece of legislation. This rollout, this implementation is blown to smithereens. And it really is throwing everything up against the wall on a daily basis to see what sticks. They don't even know who is paid. Yeah, maybe my all-time favorite statistic in all of this, they don't know how many people have enrolled, but they tell us, oh yeah, we got 6 million, but they don't know. But they don't know how many have paid because the website does not have a mechanism at the back end to report that. There is no such back end on the website. How stupid is it, or how intentional is it? Wait a second. They haven't. Snurdly says, well, how stupid is it to open up a business and they have no idea who's paying? This isn't a business. They're not in competition with anybody. What do you mean? They can do whatever they want. How stupid. They've had 3 years to put the back end in it, and they still haven't done it. The question is long past the degree of incompetence here. It's long past that. The questions need to change now. What is the real purpose? Why would you build a website that cannot record payment and signify insurance companies that policies have been purchased? Why don't you have that in the website?